identifying who is a suspect. That is all we're doing. We're testing, we're basically trying to identify somebody based on syndromes. So the syndrome there we're looking for is the temperature. If we get the temperature that is meeting the criteria, we then shift to ask a few questions. If those clients or those people coming from those vehicles meet the criteria, then we isolate, or rather quarantine, and then have them tested. In the epidemic next week, we are raising that issue because as Minister of Health in Sinazongwe, we are actually saying we might be closing there because in effect, because of the phase we are in of the epidemic, it's about finding the patients exactly there's no time to look for syndrome. It's about if somebody is meeting the criteria, call us, we are there to get a sample and send it for testing. That is the approach. So it wasn't.
Amala Owen, the Health Promotions Officer for Sinazongwe. I'm encouraging all members of Sinazongwe to take the Minister of Health preventive measures seriously. COVID is real and prevention is cheaper and better than cure. I'm just encouraging them to do 5 things. 1, to mask up. Make sure that they put on their mask whenever they leave their homes to the public, at church, at the market, at the grounds, everywhere where they are going. Number 2, they should always wash their hands. If they don't have water and soap to wash hands, let them use hand sanitizer. Number 3, they should make sure that they maintain social distance for at least 1 meter apart, or even 2 meters apart. They should avoid unnecessary travels to crowded places. Stay at home if you are not feeling well, and make sure that if you have traveled in the last 14 days or 2 weeks, isolate yourself. And if you are not feeling well, you have got the signs and symptoms, kindly call 909, a toll-free number. Don't need to pay anything. They will respond, they will communicate to the health authorities who will come and attend to you. Let's manage this COVID-19 together. We should not leave it to one department. No single department can fight the COVID-19 alone.
Jeff Kayamba, KDF, and then the Imutabi Wajem. Travelega, I Higoro Hili 20, Yobiro, Kujoma 18 Ogun. You know, Imagadingai, Ibulas were COVID, Ibola Segampona, Ibola Badichari, Ona Bamui, Ivana covered with you. So I am to Tubasujapo, not to Bahiri, Igupa, Iberesio, you go out to Ivana, Bamai once, a Machani, Madiba, Mulas were COVID. Cambo Mulazi, covered each other. No one has no one among and the one below to Mula, Mama Seta, Imuraja, or to Wawachata. To be given man. Imohara, one of Tangandam packet. Iguli insipa amenda gusamba ibasatolege inyendo yagunka kwendenda amuma dirwe mulango ya mwagitabyo ndamba y'abantu bashondo noto madire kunguluke mubadirwe tulobweza bulazo kambo ichomeni koboli bulazo imatata mama especially windo no mama ndinyo mungabirira migwashe amubone uti mwatugwabirira tomatata abana bonse alubwa amubone uti bana barasamba kumanza amubone uti ali mu tonka ku market bari samide ega maski gali mbuligaga kuli mbondi samido kuli gwabirira igumpemo iguzawawa amulomo bonse kuli gwabirira mboga samuo amubone uti mwasamani munka ku market amubona tumukano jate ya ujata alimwi ayiko naguli jatago meso kamutana samba pe ologuli jatago mpemo kamutana samba kambo obulazi kunjirira mugateka meso mpemo bagomulomo so amubone uti tose topagamana akubona uti na turasambala atubike menda mpoto sambalira kutegwa mwali kwabirira ali mwagwabirira banzi ibe yogo
coming from Jehovah Elohim Ministries International and Shalom Deliverance Center in Mamba. And my message is very simple, ladies and gentlemen. COVID-19 is real. It doesn't matter who you are, it doesn't matter what you have accrued to yourself. You need to protect yourself and protect the next person. Speaking from a religious point of view in our churches, let us not become over spiritual about these things, because not everyone is as spiritual as you are. You are also physical. And so we need to mask up. Use hand-based sanitizer, clean your hands. If you don't have that, we have soap and water, as simple as that. Let's be real and do the right things. If you are not able to have all those things that are required by the health people, for our sake, let us stay home. Don't be like, on a lighter note, I met a young man who was telling me, safety belt, you're not doing it for anybody, you are doing it for yourself, you are doing it for your family. So if you love yourself, you love your neighbor, let's keep safe. COVID is real. Mask up, wash your hands. If you have no business going out, stay home. Thank you.
Hello, let's talk about coronavirus. For a long time now, we have been talking about coronavirus, and so many have died and they are still dying. And people don't see how serious it is. They are not masking up, they are not washing their hands, they are not keeping social distance. But I want to say from here in Sinazongwe that working with the cooperating partners, we are saying we are not getting COVID-19 because we are adhering to the guidelines that have been provided by the Ministry of Health, World Health Organization, and Center for Disease Control. To our friends out there, I want to tell you that COVID-19 is real. And we have to make sure that we take precaution, we protect our loved ones, we protect our friends, and we protect ourselves against COVID-19. Above all, we protect our community, we protect our district, and we protect our country. This should be a responsibility for each and every one of us. We thank our partners. For us in Sinazongwe, we have World Vision that have done so tremendous work in helping to prevent the spread of COVID-19. We have Care International, we have UNICEF, we have local NGOs like the School Club Zambia, Kaluli Development Foundation, the local authority, Ministry of Health, and so much partners that have come on board. And we invite you, we extend our hand that you may work with us to make sure that no cases of COVID-19 spreads even to our communities. We thank you, and we thank you for your support. And for now, we say, stay safe and protect ourselves against COVID-19. Thank you.
Alright, coronavirus is real. Coronavirus COVID-19 is real, and we really need to protect ourselves from this deadly disease that has come. It's not only in Lusaka, Copper Belt, or any other provinces. It is in southern provinces. We need to protect ourselves. We need to mask up. We need to hand wash. We need 1 meter social distance. We need to avoid crowded places for us to protect ourselves. We need to protect ourselves, protect the families, even protect our beloved ones, because once you contract it, meaning you are going to take to other people. You're going to take it home, you're going to take to other people that you're going to be in contact with. We need to protect ourselves. A health area is a wealth area. Thank you. Hand sanitizer, you need to use it, not just getting a drop of it. Instead, you need 5 mils of this for you to ensure that you are protected, and you are protected for a longer period, and that the germs that you have in your hands have been destroyed. So we really need to use this hand sanitizer. It's not for decoration, it's for use for us to protect ourselves.